Hi, I'm Nancy Mendenhall, the medical director of the University of Florida Proton Therapy Institute. And I thought I might share with you a little bit of background about this institution. The concept for the University of Florida Proton Therapy Institute was actually presented back in 1998. At that point in time, we became aware of the potential benefits that might come to patients from proton therapy. We knew from many years of practice that while radiation given with x-rays was very, very effective, it also carried significant side effects and toxicities associated with it because of the radiation dose to the normal tissues. You see, when we use x-rays, it's like using a bullet. That beam of x-rays passes through the patient like a bullet, leaving a track of damage. And we have damage in the normal tissues before we get to the cancer, damage after we pass through the cancer in those normal tissues. So we have to manage that, and for decades, our success in radiation oncology has depended on our ability to distribute that radiation dose with as high a dose to the cancer and as low a dose to those normal tissues as possible. So in 1998, we realized that protons were very, very different. Instead of passing through the patient, leaving a track of damage, they stop. And you can make them stop wherever you want them to, whatever depth is the depth of the cancer. They don't exit, so there's no exit dose, and they cause much less damage on the way in than do the x-rays, because they're a lot heavier than the things that they're bumping into, and they carry most of their energy to the end of their range. So we realized that with protons we could put most of the radiation dose in the target instead of in the normal tissues around the target, and that would surely result in fewer side effects and complications to the patient. And if we had fewer side effects and complications, we could increase the dose and get higher cure rates. And maybe if we had fewer side effects and complications, we could shorten the time over which the radiation was delivered, possibly getting higher control rates, and definitely reducing the cost of treatment and the inconvenience of the patient who might have to travel in order to get the radiation treatments. So for a lot of reasons, we saw potential advantages with proton therapy that would improve the outcomes in almost all patients who needed radiation. So the idea was discussed and presented in 1998, and then we had to decide where to put it. In Gainesville, where the university was, where our practice was. Gainesville's a relatively small town. In contrast, we also had a University of Florida campus here in Jacksonville. At the time, Jacksonville was the 6th fastest growing city in the country. It had an international airport, it had a seaport, it had an interstate highway that passed right by the medical facility, so that meant that patients would be able to get to the facility easily. Equipment could be brought over by boat. Patients could fly in from a long ways away. And then in addition, there would be lots and lots more patients needing cancer care in the future. So we decided Jacksonville was the right place to put the facility.